Welcome, everyone.
Maybe getting lost. Patricia is the Spanish get that B from conference. I think it's so organic. It's not going to happen. Oh, yeah. I thought the one was there. Yeah, yeah, yeah.
Fantástico. También hablo un poquito portugués. No. Now we're still I know, me too.
Yeah.
For trouble.
Yeah, yeah.
Okay.
Ok,
Lovely.
bem-vinda. Então,
I
você
think-
vai empezar.
I think we can go.
Ok.
Yeah.
Voy a hablar en inglés ahora.
Se fue traducción.
Está bien. Está bien. Well, good morning again. I think now we have all our speakers in the room, and welcome everyone. I hope you still have a lot of energy, or even more energized after like 4 days now, right? For those who have been here since Monday. I think it's been very excited so far. My name is Paula Jones. I'm from Brazil. I'm the founder and executive director of ACT Health Promotion, and we are a member of NCD Alliance. And I'm here, I will introduce this panel and the objectives of that. The air pollution as a risk factor for non-communicable diseases, and including mental health and neurological disease. That's a long name now. It's been like since 2018. Well, air pollution has been incorporated formally in the NCD's meeting, but we are still really far from getting it incorporated really in terms of implementation and becoming part of the NCD agenda. And I think that's pretty much our objective here today, to have conversations on how we can make it happen collectively. Like we have a lot of civil society organizations and like government representatives. And the idea that we have like brainstorming and conversations as freely as possible to have ideas and explore possibilities and how we can make this happen, because it's our will that for the next high-level meeting that will happen in September in New York, that this becomes a real issue. And I think this conference has been a great opportunity to like explore like possibilities and venues and ways of doing it. I'm talking a lot about myself now as someone that's not from the air pollution community too much. It's a very new issue for me, being from the NCD community, and I saw so many links, so I'm so excited about it, and I hope we can all be very excited about it and able to have like the 5 risk factors really dealt with in a very effective way, that we make it happen in the implementation phase, because we are off track of the SDGs, we are off track for the NCD's targets, we are really off track, too many things in the world right now, so we really need to be kind of energize and like really try to do our best. That's what we have to do right now to make it happen, and to make environments healthier for everyone in the world, right? Not leaving anyone behind, and try to catch up with the targets that we are late. I'm not sure it will be possible, but I'm sure that we can do better than we are doing now. So that's our responsibility here collectively in the room, try to find like ways and discussions and to how we can do that. And taking on everyone's expertise here. And it's nice to bring groups from different areas, because then you have like a different views, and that can be very rich to find ways of doing things that we have never thought about before. And I need to thank all, because that's a team effort. A big thank to Dan, because he's gonna introduce shortly the advocacy guide for this collective effort to make it happen for the next high-level meeting and with air pollution, and the organizations that have done it together. In addition to NCD Alliance, United for Global Mental Health, the Global Climate and Health Alliance, UICC, the World Heart Federation, and Clean Air Fund for making it happen here. So we are very happy with all the organizations here that we are doing this together, and it's great to be here. And I'll pass it on to Dan, that he will introduce the great advocacy guide, the summary of it, and we'll be ready in April, right, Dan?
Okay, lovely. Good morning, buenos dias, everyone. We'll just grab the clicker. Thank you. Okay. Yes, good morning, and a pleasure to be. Oh, sorry. Okay. Yes, and a pleasure to introduce an advocacy guide. This advocacy guide that we have prepared on air pollution and NCDs. And when we talk about NCDs, we are including mental health and neurological conditions within NCDs. I don't want to take long. I want to give you 5 key facts that I hope you will take away and remember. Fact number 1, you have seen and heard lots of data over the course of this week. When somebody and an adult dies from air pollution, it is almost certain that they die from an NCD. 9 in 10 global deaths are from NCDs, and almost half of COPD, more than a quarter of heart disease and stroke, and around 1 in 5 deaths from lung disease and from type 2 diabetes. That accounts for around 7 million people every year. And what's missing here is mental health. And we have lots and lots of data on the causal pathways of harm and a bit less data on the scale of the numbers and the disease burden. We've heard this week how air pollution has catastrophic consequences for the global economy, and the drag and the undermining of already limited resources for the NCD response that entails. We hope to hear more a little later about the right to the environment and the right to health, but air pollution clearly undermines the ability to attain the highest attainable standard of health for people living with NCDs and their families and their communities and people who are affected by NCDs. And we also know that air pollution is not a risk factor in isolation. So for those of you who've worked in the space in NCDs for a while, you will know what is called the 5x5 approach. This is a political commitment to tackle the 5 key risk factors for non-communicable diseases and the 5 key NCDs. And it's easy, I think, using that approach to think about each risk factor in isolation. Whereas actually, the process of making, distributing, disposing of tobacco, of alcohol, of ultra-processed foods and beverages leads to air pollution. And also air pollution undermines the ability for people to be physically active, and it undermines the conditions and food security for which you can grow nutritious food, reducing yields, increasing crop toxicity. So yes, it is absolutely a critical risk factor in its own right, but it is also synergistic and worsening for the other risk factors for NCDs. But fact number 5 is good news. So we know that there are a series of interventions for air pollution that are effective, cost-effective, equitable, and scalable. And as we've heard over the course of this week, these interventions are multi-sectoral and where we need to bring health to the forefront of cross-government conversations on energy, on transport, on industry, on the built environment, and on waste management. So the UN high-level meeting, what can be done? As Paolo was saying, this is the 4th UN high-level meeting we will have on the prevention and control of NCDs and mental health. The 3rd meeting was in 2018, and we remain off track. While we have seen a great deal of political commitment to the NCD agenda, the actual implementation following up has been very slow. Only 19 countries, as it stands, are on track to reach the NCD-related targets for the SDGs. So what can be done? We have a series of key action areas on accelerating action on air pollution and health. We need to see the urgent integration of air pollution within national policies and plans for NCDs, to regulate high-polluting industries and acknowledge that commercial industries that are misaligned with NCDs and health have no place in the air pollution response, and adopt a series of best buy interventions for air pollution. So if you are a Minister of Health currently in the room and you're working on alcohol or on tobacco or on ultra-processed foods and beverages, you have best buys that you can go to and you can pick up and you can shake and say, this is what we need to do. And I know there is lots of goodwill to do the same for air pollution, and as civil society, we can really pull behind that push to make the case for a similar approach. As we discussed, the interventions that we need to see are multi-sectoral. Breaking down silos between health and environment and other disciplines is critical. As is mobilizing investment, we saw the catastrophic impacts of air pollution on GDP. We also know there's very, very little ODA that is committed to air pollution. It's around 1% of global ODA. And the other thing that we really need to see is more and more evidence on the cost effectiveness. So when you're adopting an intervention, how cost effective, how quickly is it going to pay itself back? These are all really, really useful things to mobilize the case for investment for air quality. Building accountability for air pollution in the global NCD response. Now, it might surprise you that there aren't a great deal of data and indicators and surveillance monitoring and reporting efforts related to air pollution and NCDs. So we have tons of targets related to tobacco and to other areas, but we don't have a formally integrated air pollution indicator within the NCD response. Now, that hopefully will change based on the big commitments we've seen over the course of the conference this week and recent WHO commitments to halve anthropogenic sources of climate change by 2040 relative to 2015 levels. And the last one, of course, why we're all here, lots of civil society in the room. We need strong policy is made by learning from the people who are most affected by that. And that is not only people who live with NCDs, that's people who cannot avoid breathing toxic air, and really demanding co-creation and meaningful engagement in policy processes. So the how, the advocacy guide that we launched today will set out a series of activities for you to prepare, identifying, engaging your policy champions, demanding the inclusion of people who live with NCDs, and then working together as a collective group to share knowledge, to share intelligence, to share your best practice, your case studies, your learnings, what's worked well, what hasn't worked well. And the fourth and the kind of sort of final important part of this is the participatory processes. So yes, the meeting is happening in September. There are lots and lots of political meetings that happen between now and September. And there's one that I will flag to you that closes on Monday, which is a multi-sectoral hearing that's on the 2nd of May. The registration for that closes on Sunday, and I will share the link to this. And of course, we wait to see what happens in September, and we wait to see what kind of political commitments on air pollution we get within the UN high-level meeting on NCDs. After that meeting, it's up to us as civil society, as government actors and other people in the room to demand that political commitment without action is inadequate, and to really mainstream, normalize, and celebrate the success of commitment to interventions and the delivery of work. So that will be both through the UN high-level meeting, also through the NDC process. Big climate commitments happening this year, and making the case for the mainstreaming of data, sharing knowledge, sharing information, and making sure that air pollution is not just given lip service within the global NCD response, but is monitored, is counted, is costed up. And building civil society coalitions. Lots of us have worked together in the room for several years. We might work on different diseases. And building those coalitions both within health and beyond health to make a strong case for air pollution. I will stop there. You don't want to hear from me. You want to hear from the speakers and from the countries. So we have a lovely panel who will now share a few sort of examples from their national context, the subnational context, and people working across the environment and climate and health space. So if you don't mind, I will call them up one by one. So first, Eliane Ignotti, who's from the Ministry of Health in Brazil, please. Oh yeah, please. Yeah. Patricia Passon-Valdez, who is from the city of Santiago in Chile, from the Environment, Biodiversity and Climate Department. Jenny Miller, the Executive Director of Global Climate and Health Alliance. And Nikki Catabona from the Department of Health of the Philippines. Thank you. And of course, our chair, Mark Miller, the former chair of the Air Pollution Expert Group from the World Heart Federation. We have one Spanish speaker, ladies and gentlemen, for those of you who, like me, are woefully ignorant and can't speak Spanish. So if you need to go and grab your interpretation kit, please do so now. Otherwise, over to you, Mark. Thank you.
Thank you very much. Anybody need to rush out and get an interpretation device? I'll take that as a no. Okay, Alba, just, you don't want to hear me speaking this morning. For many people, it was their last night in Cartagena last night, and I believe a few people have been out enjoying the energy So the last thing you need is to listen to me talking. We also have a very packed agenda, so I want to let you hear the speakers doing. Please try and bring some of last night's energy to the conversation, first of all. Okay, so I will take a seat just now. And you've already been introduced to all the speakers. What I would just remind the speakers is it's very packed. The organizers have given us a very long list of excellent questions, and we must get through them all. I do apologize if I interrupt you. They are. Please do, when you're thinking about your answers, reflect on the advocacy guide when you give them as well. So our first speaker is Patricia Pastor-Valdez, who's the representative from the regional government of Santiago. Patricia has to leave for another engagement, so we will just come to you first, if that's okay. Okay, so let's get straight to it. So Santiago has got lots to celebrate. You have made great strides in terms of developing a range of air quality interventions. Can you share with us what's made it so effective? Why has this sort of integrated approach to NCDs really made the great improvements in Santiago?
Thank you. Muchas gracias a todos, muy buenos días. Es un placer estar acá, gracias por la invitación. Estamos muy orgullosos del trabajo en Santiago de Chile porque hemos podido visualizar la ciudad como un todo y cada cosa, cada proyecto que hacemos en un lugar particular tiene impacto en una región de 15.000 kilómetros cuadrados. Por lo tanto, esa ha sido la mirada que tenemos hoy día en Santiago. También porque la planificación urbana no es aparte del cambio climático. Los efectos del cambio climático inciden en las ciudades, que son sistemas complejos y que debemos pensar la planificación urbana ambiental. Ahora, ¿por qué? Porque tenemos que mejorar la calidad del aire, gestionar la eficiencia hídrica, regenerar suelos de una ciudad altamente urbanizada. Y estamos exigiendo en todos nuestros proyectos y los proyectos que son financiados por el gobierno regional, soluciones basadas en la naturaleza con el objetivo de devolver la naturaleza a la ciudad, pero ¿para qué? Para transformar una ciudad resiliente frente al cambio climático y una ciudad más saludable. Es por ello que el manejo del clima urbano es parte de la planificación y debemos trabajarlo intersectorialmente con transporte, energía, Ministerio de Medio Ambiente, que son a escala nacional, pero como gobierno regional y como la metrópolis de la región metropolitana, debemos trabajar mancomunadamente para que todos los esfuerzos vayan enfocados a mejorar la salud de las personas. Y por eso el contribuir a un aire limpio. Gracias.
That's wonderful. Thank you so much. And of course, you're mentioning a lot in urban planning. Our researchers have been Googling you and doing high-tech research. And you're an architect by training, so you can bring that experience to it. What is the role of civil society in terms of air quality, NCDs, and the built environment?
Bueno, es muy importante esta pregunta porque las personas, si no hay educación ambiental, no hay avance en nuestras sociedades. Por lo tanto, es relevante llegar a cada lugar, sobre todo a aquellos lugares vulnerables, y establecer medidas de adaptación al clima. Ahora, también respecto a, por ejemplo, lo que estamos haciendo en transporte sustentable, tenemos una red de metro, una de las redes de metro más grandes en Latinoamérica, y estamos construyendo una gran red de ciclovías en Santiago, que no trabajamos por silos, porque, por ejemplo, en la construcción de las ciclovías también se debe plantar árboles con el objetivo de contribuir, ¿cierto?, al bienestar de las personas, pero también mejorar la calidad de vida, regular la contaminación, reducir de alguna manera la ventilación, o sea, mejorar la ventilación en la ciudad para contribuir a un aire limpio. Y es por ello que también estamos regulando los sectores industriales de mejor forma, gestionar de mejor forma los residuos. Por primera vez en Santiago queremos impulsar un biodigestor regional con el objetivo de trabajar los residuos bueno, disminuir las emisiones de las fábricas. Es por ello que todo este tipo de proyectos contribuyen a mejorar la calidad del aire y a trabajar en una ciudad integrada por el medio ambiente. Thank you.
Thank you very much. That's great. I mean, I echo those sentiments completely, and hopefully we will have the impacts on NCDs as well. Let me bring in some of the other panelists to share some thoughts. Sorry, you okay?
What?
So if I can turn to you now, Nikki, if that's okay. So, Nikki, you're from the Department of Health of the government of the Philippines. So the Philippines has focused really on a settings-based approach to look at air quality and how it may impact on NCDs. So how has this approach affected or influenced the Ministry of Health? And do feel free to give your thoughts on what Patricia has just said as well.
Yes, I echo the thoughts of Patricia. And air pollution is not just an environmental issue, it is also a public health concern. So in the Philippines, the Ministry of Health has adopted a settings-based approach, which was from the Ottawa Charter of Health Promotion. This is incorporating public health strategies into the key settings such as communities, workplaces, and schools in order to address air pollution. So part of our work is to enable communities to be supportive of health. So one intervention we made is we did health promotion playbooks specifically for the topics of open green spaces and active transport. These playbooks are an all-in-one guide for the local government units of the Philippines, which it contains template policies, evidence briefs, as well as tools for capacity building, as well as monitoring and evaluation. Meanwhile, in workplaces and schools, we also work with the Ministry of Labor and the Ministry of Education in order to reduce occupational exposure to pollutants. And we are also looking to the integration of air pollution awareness into the school curricula in order for the next generation to be aware of air pollution and the link between air quality and health and do something about it. That's all. Thank you.
I mean, they sound good. Are those playbooks available for the wider community to have a look at?
Yes, the playbooks are available for the local government units. It is disseminated through our regional counterparts of the Ministry of Health, and they are coordinating with the local chief executives and the local government units.
Great, thank you very much. If I may just move on. So if I come to you now, Jenny, you have the difficult issue of air pollution and climate change and how they interact. They are not the same thing, but clearly lots of different interactions. So what does that mean in terms of people living with NCDs? And also, how do the factor of NCDs itself, how does that then influence policy, health policy and governance?
Yeah, thank you. Both climate change and air pollution could be thought of as threat multipliers for people living with NCDs and as well as driving NCDs. Dan talked a bit about that in his introduction with respect to air pollution. With climate change, when you have heat waves or extreme weather events or wildfires, people living with NCDs are going to be more vulnerable, more exposed, more at risk. And then conversely, when you have wildfires, you're going to have increased air pollution from smoke. When you have heat waves, that exacerbates air pollution. And when we don't think about these things together, you end up with partial solutions. So when I was working on children's asthma prevention in California, we were working in communities that had very high incidence of asthma. And in those communities, there were families that were doing everything right in terms of having their kids on the right medication, removing all the triggers from the homes. But these kids were ending up in the emergency room time and time and time again. And that's because they were living next to an oil refinery or living near a port that had diesel emissions from trucks and shipping. And in Southern California, that was made even worse because during hot days and during heat waves, smog, the air pollution was even further aggravated. So we've got to think about these things together if we're going to protect people with NCDs. I would say that the silver lining in all of this is that NCDs are the place where you can see the near-term benefits from taking action on the drivers of climate change, the drivers of air pollution. So if we do the work of phasing out fossil fuels and transitioning to clean energy, if we do the work of transportation systems that have public transportation, low emission vehicles, that will deliver cleaner air and reduced NCDs in the near term. So it really is an opportunity. The thing is that if we want those win-wins, we really have to have that cross-sectoral work. We have to have NCD advocates and health professionals, health leaders at the table, talking to the transportation department, talking to the environment ministry, and so on and so forth.
Yeah, that's great. I mean, and the science says, of course, that these factors cause effects that are probably not just additive, but synergistic. So it may be the case if we take action on one, we're actually not just having a benefit in itself, but we're having a double benefit and maybe an amplified benefit. So that's great. Eliana, may I move to you, please?
Yeah.
So can you tell us something about how Brazil has effectively collaborated with civil society? We'll come back to civil society again, and really to talk about how civil society has helped this integrated action on air pollution and NCDs.
Wow. Good morning. I'm representing here the government, the Minister of Health, and every action, every activity in Brazil of the Ministry of Health has a participation of the civil society. It's a kind of the way that our health system is organized. And I believe that our most important contribution with this topic, air pollution and health in Brazil, was to prepare the analysis of the impact of air pollution and health with many outcomes, mainly chronic diseases. And we published disclosure for all society, and it was very important because we could influence the National Council of the Environment during the negotiation of the new standard for air quality in Brazil. It was a very hard negotiation, very hard discussion during the last year, and our information about the impact in public health was very decisive, was very important for the decision. Many times the industrial sector, agricultural sector, they do not want to change the standard for air quality in the country, but it could show trend where some region are reducing the air pollution, the reduction in terms of deaths, then and thousands of deaths. Then it was very important, and the most important contribution of the last year, I think it was a kind of a structural contribution for this topic. And the civil society participated also of this decision in this National Council of Environment. I don't know if it's
No,
what
that's
you
wonderful.
want.
Thank you. And you had to. I'll come to you, Nikki. Eliane, and just because talking about a set in the Philippines, what's your own experience in with working with NCDs?
The fight against air pollution and NCDs cannot be won by governments alone. The civil society plays a key role in this. So in the Philippines, we work with organizations, which is a local organization, such as sustainable mobility infrastructure, and we also work with Clean Air Asia and Health Justice Philippines, who have been strong advocates for pushing stricter air quality regulations and tobacco regulations. So their work has influenced us, the government, since ensuring that health and environmental policies are aligned. So together, the government and the civil society can create sustainable and people-centered solutions that guarantee clean air.
Thank you very much. It sounds like we're all speaking from the same page here as well. Let me change tack just a little bit, and I'll come back to you again, Jenny. So we're gearing up towards the UN high-level meeting on NCDs, but there is another high-level meeting on the way here, and dare I say the C word, COP30. So what are the opportunities there to try and integrate NCDs and as well as that, NDCs, the nationally determined contributions? How can we influence that?
Yeah. The NCD perspective, I think, is vitally important to influencing action on climate change. As I was saying earlier, some of the greatest gains from climate action for health can be found in the NCD arena. And this in turn means that if we want to get those gains for NCDs, we have to influence that climate change agenda. So those are two key opportunities. The COP30 is coming up at the end of the year. It's a challenging negotiation. There is a dedicated stream on mitigation of climate change, which is where the work to reduce air pollution would happen through a call for phasing out fossil fuels and that type of work. But an organized health voice can nudge that conversation in the right direction. I think a perhaps easier place to intervene and a sooner, but more urgent, time-sensitive place to intervene is in the nationally determined contributions. So every country under the Paris Agreement has to develop its national climate plan for delivering its fair share on, reaching the targets of the Paris Agreement. The majority of countries are still in progress in developing those national plans. They're meant to revise them this year. And every national plan could integrate targets on air pollution reduction and quantifying the health benefits of that. So that's a really key moment to call for integrating health into those nationally determined contributions. And that sets a country's national climate plan, which then ideally will turn into national policies to implement those plans.
Yeah, I couldn't agree more as well. And I think hopefully at the next COP, we will see a greater focus on health as well. And we do need more. We do need more cost benefit analysis to include not just morbidity, the lost work days, but all the long list of streams, how it affects the economy. Eliana, if I can come back to you again, don't worry, I'll be nice. So we're discussing the advocacy guide for NCDs and air pollution. And of course, what we need to stress is this is not just about talking about political commitments. This is about what gets done. And of course, if we can base this on data, there's more likely that we'll get this done. So if I could change tact a little bit and talk about air pollution monitoring. So what is Brazil's approach to air pollution monitoring, and how can we use that then to make changes with NCD policy?
Well, monitor air pollution is one challenge in a area, in a big country as Brazil, of course. Then I'm just a brief introduction, short introduction. Then we decide to work with modeling data. Of course, we have some places in Brazil with a very good monitoring, but it does not represent all the territory. Then producing data for all area of the country open the door to work with chronic diseases and mental diseases is most difficult because the kind of data, but some kind of approach as suicide. Then what I mean is that data is necessary. Monitoring or modeling data is necessary. If you do not have data about air pollution, you cannot discuss. It's the basis. Then now we got a way to talk about air pollution. This is the point. The chronic disease is in another department, but we talk to them. We have access with the database of chronic disease. Then we can show the impact and discuss some conduction in terms of chronic disease. One short example. Can I? We had a critical episodes of air pollution in Brazil. I can say in Brazil, it's happening in 70% of the area of the country. Then we had one room for climate emergency situation. And during this situation room, we had meeting every day with many sectors of the Minister of Health and the states and municipality discussing what should they do. And one point discussed that we decide to take care, pay attention, was the healthy units, primary care and emergency should be prepared for cardiovascular disease. People that has chronic cardiovascular disease, then the population should be oriented by media and health prepared for the consequences of the critical episodes of air pollution. It was just one short, small example about where we lived the last year. And we could do this because we had the analysis for the country to show what happened. And the discussion was not only about take care of respiratory diseases, take care of children and elderly population, that is important, of course, but it was not usual to talk about infarction, the risk of infarction, the risk of stroke for people that has chronic disease. That's it.
Thank you. That's useful examples. I've been given a new microphone. Can people hear me now? Okay. No? Still? No? Should I apologize if you can hear me or you can't hear me? Okay. I'm not sure that's better. Oh, there we go. Hey. Well, that's the end of the session. I have a reputation for going over time, but I think we're just in time. So if I can just ask everybody one last question as well. I'm going to go around in turn and just ask you one sentence, one message that we need to take to the next, the high-level meeting in New York. Patricia, I'll start with you first. Thank you very much for staying to the end.
Sí, es difícil resumir en una frase todo lo que hemos visto en estos días y la importancia que tiene trabajar por el medio ambiente y por un aire limpio, porque como lo decían en otros días, el aire puede matarnos si no estamos todos trabajando en conjunto. Yo creo que la unión de estos días ha sido significativa para el traspaso de competencias y me llevo a Santiago de Chile la tarea de traspasar lo que hemos conversado en estas instancias para que podamos avanzar en proyectos concretos que sumen a un aire limpio. Gracias.
Well, I have two, but I will choose one. Oh, okay, let's try. Ensuring the right to clean air is not an option, but an urgent political obligation. Effective environmental monitoring, shift emergency response, and strong political policies are essential to reduce air pollution and protect global health now, not later.
I think my thought for the high level meeting is, we won't be able to resolve the challenge of NCDs without tackling air pollution. It's critical. And similarly, climate change. And we're in a geopolitical time when we're facing great headwinds. And we're also up against some industries that do not want us to solve these problems. So going into the high level meeting, we need to really come together as a health community and be ready to have a strong voice and bring that strong voice to those challenges.
Thank you. So clean air is a fundamental right and a public health imperative. It has been echoed within the 5 days of the conference and even before that. So to achieve meaningful progress, we have to scale up multi-sectoral action, enhance accountability, and prioritize air quality. Let us act together with urgency because every breath matters.
Well, thank you very much to all. That was great, inspiring words to end for everybody. We are going to have a brainstorming session in 5 minutes. The doors get closed and locked, and you're stuck here. Please, during your discussions, reflect on some of the things that our speakers have said today. But first, once again, thank you very much to everybody. Feel free to take a relaxing seat, and I'll pass on to our next host.
That was wonderful. Thank you. Now I will ask Merit for a brief reflection, but before that, we have 2 questions for you. But before that, I think we should everyone give a big, big, big round of applause for the work that they have done to put Merit and all her team, the work done for this wonderful conference. I learned so much and I'm very thankful to it as well. So one of the things is, what are the main takeaways, milestones from the last years that we can be proud of? Because I think to move further, we also need to look at the good things that have been done. And the second thing, how can civil society best help for us to achieve what we want for the high level meeting? Thank you.
Thank you. And thank you to all of you, for the conference as well. For me, it was sometimes a bit difficult to get governments there, but civil society, we could count on you. So big applause to you as well. But when I was asked to talk here, Dan said to me that I could actually talk about what I wanted. Since it's been quite some hard days here. And then, we had the reception last night. So I talked to my CCAC colleagues. I went a bit back in time. Then I thought, okay, I just have to talk a bit about some big surprises, big wows in my life, which I think are very relevant to what we're talking about here today. And that also changed my career, I could say. So the first big wow happened in 2010 in Cancun, COP16. I met Maria Neira. I was a Norwegian delegate. I worked on climate change for 10 years, negotiations, IPCC, all that. And everything was about land use change and forestry. It was shipping and aviation, adaptation, mitigation, all that. And then she talked about health. And I was just, wow. because we had no delegates from the health side in the negotiations. Nobody talked about health. There was not on the agenda. So then I was, no, this is not possible. So I worked in the Ministry of Foreign Affairs at that time. So I went back and then we started funding WHO's work because we saw that's really needed. And then the next wow was in about 2012, I think, because I was involved in the Climate and Clean Air Coalition work from Norway again, after the big crisis, I would say, in 2009, the Copenhagen COP, which was a failure. The CCSC was established, of course. And then in 2012, Drew Shindell, he was the chair of the scientific advisory panel of the CCSC. And he talked about, sorry, I think at that time, 6 million deaths from air pollution. And I wasn't aware. So I was just, wow, how is this possible? And then why are we not talking more about this? And then I thought, okay, this is the solution. Is really, you talk about the 6 million deaths, you can save those lives. At the same time, you can limit climate change. 2 in 1, of course. And health is the key. But yeah, that's some years ago. Maybe we're not there yet. But for me, that was a big wow. So I just changed completely from working on climate change to working on air pollution. And in the Ministry of Foreign Affairs, we built up a program on air pollution. So we started supporting WHO's work in 2014. And then in the meantime, in 2013, we had a health ministers meeting in Oslo, so under the CCIC. And then we had the mandate to establish a health task force. And one thing that was also adopted at that time, we should develop or have a resolution on air pollution under WHO. The other one was to have a public campaign on then air pollution and the health impacts of that. So I worked with Carlos Dora. We were the co-chairs of that health task force. And then the resolution was adopted in 2015. And then we had the Breathe Life campaign, which was launched, I think, in 2016. So that was, we were really happy about that. And then the third wow, that was actually a bit negative, because then I started working in WHO. I was seconded to WHO. And then in the air pollution unit and also climate change unit. And then I found out, oh wow, Norway is the only country supporting this work on air pollution. How come? It's so important, even so little money. And then, of course, we worked on the first conference in 2018. I was coordinating that work. I hope that was a big wow in 2018 as well. And for the conference, I mean, we were chasing the NCD people to get involved, to be interested. And they came to the conference. So I think they found out this is important for us as well, but it was really hard. And then we also had then, of course, in 2018, that has been mentioned, the 5x5 was then, we were so happy about that was included in the political declaration at the third high-level meeting. So, but then after the conference, I went back to Norway, and I worked in the health unit of the Ministry of Foreign Affairs. I started working on NCDs, and then I had my, is it fourth? A bit negative, wow. Because, I mean, NCDs, like Dan said, others have said, 51 million deaths, but I think maybe we should talk more about the premature deaths. Is it 15 million? And we're not talking about it. There's so little funding. So in Norway, the parliament asked the government to develop a strategy on NCDs because the burden has shifted from communicable to non-communicable since 2000. Heavily. I mean, yeah, you all know that. I don't need to say that. But even so little funding, so little attention. I was just shocked again. What's happening. So in our strategy, it was launched in 2019. Yeah, Maria Naira was actually moderating. She came to Oslo. Katie Dane was there. It was great. And then we started funding also NCD work in WHO. And I coordinated that work. So say Marianne, she was heavily involved from NORAD side. Wave. Yeah. So Then, yeah, of course, I mean, I said 5 by 5. I think people in WHO call me the 5 by 5 lady. It's air pollution was so important in the strategy, of course, and also mental health. Our minister, I remember, he was totally, for him, that was very important. But then in 2023, I started working for WHO again on NCD in the NCD unit, and then actually on integrating air pollution and climate change into the work on NCDs. And then it was a surprise again, because when I came to WHO, I just saw, oh, wow, 2018, and then we had the resolution, WHO in 2019, on really saying that we should integrate air pollution. It should be 5 by 5, should be integrated into the NCD work. And we weren't there at all. I was actually surprised, negatively again. But then, I mean, I can also understand it, because when you see, we talk about pockets of poverty. I mean, air pollution, not many donors. You saw the team here now working on the conference, and they have to work on the basics. It's about, yeah, you know what they're working on. It's really supporting countries in their work. It's a huge issue, so many people dying. There's a lot to do. And then also on the NCD side, they have one person working on cardiovascular disease in WHO. One person working on the chronic respiratory diseases. And I mean, what can you do? You do the basics. You don't have any time to integrate, to work across the silos. But it's really not a lack of will, I have to say. It's a lack of resources. I mean, they can't. And when I also have to say, when I came to WHO, I saw the web pages. On the cardiovascular disease, air pollution wasn't mentioned. And you look at the package of essential NCD services, almost nothing about air pollution again. So, but then my job was then to try to promote some integration. So now, at least in the web pages, air pollution is all over there, all over the place. And we also have, when you talked about the winds, yeah, that's what's actually what I was supposed to reply to. I would say now you had a hypertension guideline, and it's also now you have air pollution as a risk factor included in that. We've had hard talks on air pollution and NCD, and also the roadmap on air pollution, I have to say. The team has been working so hard, and NCD is absolutely integrated into the roadmap. And I would also say the conference, I mean, we had a fantastic NCD session, and that was organized by the air pollution unit, the mental health unit, department, and the NCD department jointly. So there's a lot going on. And also I was working on we have a work plan for how those units should work together. And also, I'm also working on some technical guidance for health ministries, for hospitals, so they know, how to mainstream, I would say, air pollution into NCD services. So there's a lot going on. And then for the high-level meeting, I would say WHO is just full of support, everything, open doors, there's nothing there. They're very supportive on having air pollution strongly integrated in that political declaration. So there's a lot of support there. But now, of course, it's over to the countries. I've been involved in these UN processes before, like Habitat 3, and I know that it's very important then to try to work on the countries, to convince them that this is important. And then, of course, civil society is super important. And I also, just to say that for the NCD strategy that we had in Norway, the development strategy, it wouldn't have been asked for by the parliament if it wasn't for civil society. You had strong civil society groups, worked on the parliament, they asked the government to do this, that's how it was done. So, your job is extremely important. So to put pressure on the governments to, like we talked about all these conferences as well, create awareness about these links and about air pollution and the impact of health, everything. That's extremely important. So, but I think also, when you look from the air pollution side, I'm also very happy that we are not just stopping after saying 7 million deaths. Now it's from cardiovascular disease, from respiratory, because people think about respiratory but not the others. And they, as we know, are very important as well. Diabetes and mental health and the whole range, as you all know now. So I would just say good luck with your important work up to the high-level meeting, and just work with the governments so that because they are the ones that will adopt this declaration and that will negotiate it. So do all you can. Like, I think I haven't been, I think the NCD Alliance had had a paper on, what should be included in the declaration. Those kinds of documents are extremely important. I remember as negotiator for Norway for this habitat declaration, for instance, I had very good documents also from the civil society saying this and this and this should be included. And then I could look at what was then in harmony with the Norwegian positions, and I could use that language. That helped a lot. So that's also very fruitful. Thank you.
Thank you so much. That was really, really, really helpful. And I think it gave us lots of insights. So it's now time to discuss in smaller groups, in the breakout groups. So I will give you the name of the facilitators and the topic. I mean, the general idea, there will be like a facilitator that has expertise in a specific topic. So you feel free to move around if there is a topic that it's closer to your heart. So I'll ask first, Rosie from UICC will take on the cancer perspective and climate, cancer and climate. So Rosie is there. So whoever is interested to get a deep dive on cancer and climate goes to that table. Ale or Ao? Ale. Ale Ale will talking about the mental health perspective. Ale, stand up in this table. So if you want to talk about the mental health perspective, come here. Suzanne from Maccabi Center for Law and Cancer, legal perspective, very important as well. And she'll be there. Kelsey from the World Heart Federation is over there. So whoever wants to get the heart perspective goes there. Yasmin from the Clean Air Fund is on that table. Are we done or we are? And we were supposed to have a Spanish table. Anybody here who only speaks Spanish? I see no. So, okay. So that's it. Are you going to sit where you are, or shall I say it again? I'll say it again. Yeah, I thought so. So Rosie, cancer and climate. You want to sit over there? Huh? All topics are important, okay? So it's not that it's just like, okay, that's an important thing that I haven't announced. The facilitators will take some notes on what has been discussed, and we'll share the notes with all the participants. So don't worry too much if you think you should be in all tables simultaneously. We'll be fine. So again, Rosie there, cancer and climate, that table there. Ale, this table, mental health and climate. Suzanne, legal perspective over there. Kelsey, heart, there. And Yasmin, health and climate over there. Are we good? Are we ready to go? Facilitators are all. Anyone has any questions, ask me about the tables. And please join the tables. I think the perspectives, both from civil society and governments, are very relevant. And after this activity, we'll have Astrid, the UN Special Rapporteur, with the final remarks. So I just say, don't leave the room, because that will be the best part of it.
pediu, ele falou, eu tô aqui. Ele falou, nossa, queríamos tanto falar com ela.
Ai, sim.
É.
E ela estava aqui?
Não, ele não tá aqui,
Ah,
mas
ele não
ele
tá
soube
aqui,
que eu estava aqui, aí ele pediu para eu.
Ai, claro que
É. E eu vou passar o seu contato
Pero
para ele.
eu vou escrever como, porque aqui este e-mail no é direto